Everyone, I'm Sara Skonieczny, the Clinical Youth Specialist for the City of Somerville and the Coordinator for the Somerville Trauma Response Network.
And I'm Vaughan. I'm the Substance Use Prevention Coordinator for the City of Somerville's Office of Prevention Services.
The start of the school year is looking quite different for everyone. It has brought new stressors and challenges to navigate for parents and caregivers, students, teachers, and school staff. Stress and anxiety can be common during the school year, but with the pandemic continuing, it's even more important for us to pay attention to the toll that isolation can take on us. This year is extremely important that parents, caregivers, and school personnel check on their own mental well-being and learn to recognize the signs that a young person is struggling with their own. We're going to take some time today to talk about these challenges and to provide some strategies and tips around taking care of yourself and each other during the next few months. One of the most important first steps will be finding ways for parents and caregivers and teachers and school staff to work together to manage remote learning and support students during the next few months. For caregivers, it can be beneficial to talk to your child's teacher early in the year to make sure you know the best way to communicate with the teacher and school staff if a concern arises, or just to get updated on your child's progress. There can be a lot of information distributed at the start of the year, and it's important to make sure you know about information sessions, opportunities to interact or meet with school staff, and material pickups. These materials can help you learn about important resources available to your child, such as counselor support, meals, or potential academic help. If you feel you have missed something or have questions, remember to reach out to school supports so that you can have these answers early on in the school year. It's also going to be very important in these next few months that we're setting realistic expectations around remote learning, being kind and patient with each other, and showing appreciation for the hard work that everyone is putting in. We also want to remember that a lot of young people are struggling with their mental health, and it may be harder to notice signs and struggles without in-person interactions. Having open communication and a strong working relationship between school staff and caregivers is going to help ensure that warning signs are noticed early on and that students get the support that they need in a more timely manner.
That being said, caregivers have had to shoulder a really unique burden during the shutdown, and for that reason, we want to encourage all parents and guardians to also check in with Vaughan on what you're feeling during these times. If you're not already doing so, have you considered talking to someone about how you're doing? And this could be anyone from a therapist to a religious or spiritual mentor, or a member of the clergy, your best friend, or even a beloved family member. Check and see if your workplace or employer is offering any additional support services as well. And if not, you can always contact your EAP program through your HR department. We all need support right now, and we want to encourage everyone to reach out if you're feeling overwhelmed.
As we start the school year, we want to keep in mind that over the last 6 months, we've experienced tremendous amounts of loss. Loss of loved ones, loss of a routine, loss of security, loss of anticipated events and activities. The start of the school year can remind us of what we're missing out on during this time. Our lives look very different than they did a year ago, and it's common to miss how things were before. Part of that sadness that people are experiencing is grief. Grief is an emotion we feel related to loss, and it's a complex emotion. Many people recognize 5 distinct stages of grief, and while people may not experience all of them or go through them in the same order, these are common responses to loss. They include denial, which is refusing to accept that a loss is real. Related to COVID-19, this might look like not taking proper precautions or following public health recommendations because you feel that you will not be affected. Anger, which is an emotion many feel when they want to have control over their fears. This may look like blaming others or focusing on outside issues related to the pandemic. Bargaining, which is when you acknowledge reality, but still try to maintain control. It could look like telling yourself this will all be over by a certain date, or assuming if people look healthy, they are fine to be around. Despair, which is when the seriousness of the situation sets in. This can include feeling like things will never be normal again, or feeling hopeless about the outcome. And finally, acceptance, which is when you finally admit that the situation is what it is. This looks like focusing on what you can control during the pandemic and doing your part, and acknowledging that this situation is temporary and that there are things that can be done while it is happening. It can be beneficial to know how you are coping with grief and loss, and to identify the skills and strategies to manage this complex emotion. Along with recognizing what stage you or your child might be in related to grief, it's important to watch out for additional warning signs for our young people related to substance use and mental health concerns. When looking at potential warning signs related to mental health for a young person, the biggest piece is to pay attention to a shift in behavior for that young person. Individuals are unique and have different personalities, so you should be looking for something that is out of the ordinary for your young person. Some common signs and symptoms to look out for include problems with concentration and memory, a change in appetite, feeling sad or worthless, a loss of interest in things they used to enjoy, excessive worrying, restlessness, changes in sleep, and avoiding people or activities. If you notice any of these signs, it can be important to talk to your child about what you are seeing in a non-judgmental and supportive way. There are also mental health supports available through your child's school and in the community if you feel like additional help is needed. It can be important to take more immediate action if you notice a drastic change in your child's personality. If you see them giving away possessions with no logical reason, if you witness them engaging in risky or self-destructive actions, or expressing indirect or direct threats of suicide. If you think a child or teen is in immediate danger of taking suicidal action, call the National Suicide Hotline at 1-800-273-8255. You'll be able to speak with a trained crisis counselor who will help you find local resources and identify next steps, including connecting with your local mobile crisis team. If it is an emergency situation, make sure to call 911. Kira, what are some signs that parents and caregivers or teachers might want to look for related to substance use?
Well, I do also want to point out really quickly that there have been many reports during the shutdown about an increase in substance use across many different age groups. And the reasons for this are many, but a very common reason is that substance use is often used as a coping skill in times of distress. And it's important to remember that mental health and substance use can sometimes coincide with one another. That being said, the warning signs of substance use can actually look very similar to mental health warning signs. This could include changes in mood, isolation, changes in relationships, different in productivity and motivation levels, and more. With substance use, though, there can sometimes be additional signs that are more physically obvious. Marijuana, for instance, tends to produce a very noticeable odor in the air. For someone drinking alcohol, you could see maybe signs of slurred speech, poor balance, and other signs of being buzzed or drunk. You might also find paraphernalia, whether out in the open or hidden, and this could include vape pens, a marijuana pipe, empty bottles of alcohol, or maybe even bottles of prescription medication that don't belong to your youth. Every situation is different though, like Sarah said earlier, and the best thing that you can do is to continue to have really open and honest conversations with your youth around substance use, as well as taking steps to reduce youth access to substances at home. If you do need additional help for your child, we definitely recommend contacting the Mass Helpline at 1-800-327-5050 for additional resources and information. Although obviously, if there is a serious medical emergency, please just go ahead and directly call 911. Moving into kind of more general coping skills, there are a lot of different healthy coping skills that we can all turn to during this time, even with the restrictions put in place by the shutdown. Mindfulness is something that you can practice at home in a variety of different ways, whether this be deep breathing, meditation, yoga, or even taking a nap. Having a routine is also super important and can make you feel a little bit more in control of your day. But the most important thing to remember when it comes to coping skills is that you should individualize them to your needs and circumstances. You might not be able to meditate peacefully in a busy household, for instance, especially when everyone is at home right now. So maybe taking a walk might be a better solution for you. If you're worried about going outside during this time, maybe finding some sort of creative activity that you can engage in with other members of your household would be a good option. Also, one of the most important things that you can do right now is to stay connected to your friends and your loved ones. And whether that's over the phone or over Zoom, just make sure you're checking in with the people in your life at least a few times a week. Have a virtual dinner party together, call your grandparents, or even think about writing a letter to someone who's far away. We're all looking forward to the day when we can see one another in person again, but for right now, every little bit helps in the meantime.
It's important to remember that even when we are practicing self-care and using coping skills, fear and anxiety can still exist. Fear is a basic emotion that we all feel at one point or another. We often experience fear when we sense a threat, and it has been a common response to what we're experiencing with the COVID-19 pandemic. We can't change what's happening right now, but you can control how you let fear impact you. In addition to the coping strategies that Kira described, you can manage your fear response by talking to a trusted adult about what you're feeling and how you're staying safe during this time. You can limit your screen time to make sure that you're able to take a break to recharge. It's also helpful to think critically about the information sources you are following. Do you follow a variety of sources? Are you getting accurate information in a range of stories? It's also helpful to focus on what you have control over and what you can do to keep yourself safe, like washing your hands regularly, wearing a mask, and practicing social distancing. And make sure that you continue to have fun. Engaging in activities we enjoy regularly can help distract you from serious moments of fear and provide a sense of comfort in these uncertain times.
We want to thank everyone for tuning in today. If you have any further questions or concerns, particularly around any of the resources that we mentioned, please feel free to reach out to us. Our contact information will be listed on the screen, so please feel free to reach out if we can be of any further assistance. And in the meantime, please continue to stay safe, social distance, and take care.